couple of weeks ago, I reacted to medical scenes from Family Guy and got an overwhelming response from you guys wanting me to react to more TV shows. That's why today I'm reacting to some, dare I say, medical situations that have occurred on the highly popularized show The Simpsons. So The Simpsons have been airing on TV since 1989. But for those who aren't sure what The Simpsons is, it's an animated series on Fox that follows a satirical depiction of American life, epitomized by the Simpson family. It's actually the longest running cartoon ever. But before we get into that, my name is Dr. Jordan Wagner. I'm an ER doc that deals with every medical situation that you can think of. Gunshot wounds, COVID, broken hips, firework mishaps. I created this channel to answer the medical questions that I get from people every single day. If you find this video helpful, please smack that subscribe button and turn your bell notifications on. That way you learn when I post a new video. Alright, ready to watch some funny medical clips? Let's react to The Simpsons. Alright, let's check out clip number 1.
Now, Doctor, I want you to test me for everything. Every disease on this chart.
Okay, love it. First thing he says is, Doctor, I want you to test me for everything. We get this so often in the emergency department and primary care doctor's office. Unfortunately, there's not enough time and resources to be able to do that for everybody. So typically, it is a primary problem focused visit in the emergency department as well as primary care doctor's office.
Fine. We'll just start by drawing some blood.
Oh my gosh. I don't think I've ever had someone poke through an arm all the way that bad, but that was hilarious. It just goes underneath the skin. The veins are just underneath the skin, like barely.
Come on, keep blowing.
Oh, nice. Trying to do something called a pulmonary function test to see how well you're breathing with a crazy old school apparatus. Ancient, but very cool.
Okay, 12 centimeters. Excellent.
The modern day test does not measure how far your face gets sucked into the hose. It has to do with the function of how much you can breathe out and in. Got some treadmill tests.
I'm a big boy.
I like this medical office. I've never seen these type of stairs going up and down and circling around. Don't realize that the electrodes will probably get stuck and caught everywhere. Clear body jammed.
There's your problem.
I feel like patients have a fear when they go into like a CAT scan machine that they're going to go into this room and this tunnel of death. It's not. A CAT scan machine, just a cylindrical type of donut appearing with a hole in the middle, and it's only about yay wide. It's not very long. An MRI, totally different. That is a scary tube. But a normal test, no, it doesn't happen that way. That was funny. Let's check out clip number 2.
Now, what you see here is the radioactive dye we injected flowing through your husband's circulatory system.
All right, that's super cool. The radioactive dye, we never get to see it this way kind of in live function. It's very rarely. You can do bone scans where you get radioactive isotopes injected into your body and then you can see where there's injuries. PET scans do the same sort of thing where they're having these type of images, as well as even the HIDA scan for your gallbladder. So we have multiple different types of images in medicine that use radioactive markers that light up on a scan to see active cells going on. So here with the vascular system, it's actually pretty cool. You can see the couple chambers of the heart. You can see basically the main blood vessels and all the offshoots, so pretty awesome.
But doctor, I haven't injected the dye yet.
So they haven't even injected the dye yet. Of course, Homer had some sort of abnormality going on.
Now, Homer, this is a new body fat analysis test. I start you jiggling and measure how long it takes to stop.
So a body fat analyzation does not occur by smacking someone's fat and seeing how long it takes before it stops jiggling. No. So at the doctor's office, you use calipers. Calipers pinch the skin at your tricep, your hip, and your buttocks. Then you average those numbers together and you get a percentage of body fat. Let's keep going. Oh my gosh, it's still rolling.
Yes.
Oh man.
Nurse, cancel my 1 o'clock.
Yeah, so no, the only time actually in medicine where we might push on an abdomen, we're checking for what's called a fluid wave. And that happens when somebody has acidic fluid or something called ascites in their abdomen. Typically this happens with liver failure. And we can see if there's actually fluid in the abdomen. You can actually tell if it's moving. Let's check out clip number 3.
everybody!
Surgical scene. Super cool. Before we even start, old school operation theater. This is super cool. They actually still have these in some hospitals. You can see them in old school movies. But I trained and did some rotations at Massachusetts General Hospital, and they still have their old school surgical operational theater. And it's actually called the Ether Dome. We have modern medicine now, but they actually used a type of ether basically to knock somebody out so they can operate on. Pretty crazy back then.
Let's not get the law involved.
So it's not for non-medical people. So he's got to get sterile, you got to scrub, you're in there for a couple minutes. Specific way everybody in medicine is trained to clean themselves to go into the operating room every single time. You need to be sterile for that patient to reduce risk of infection.
These gloves came free with my toilet brush.
The gloves should not be free from your toilet brush. You get surgical gloves that are sterilized and you put them on in a very specific way when you're in the operating room. All right, and Homer just got knocked out by gas. So modern day medicine, now we inject you with a sedative, knock you out that way, and then we keep somebody sedated and tightly monitored. That way we can control how deep you're sleeping and then be able to take it off and you can wake right back up. All right, the doctor's sweating a crazy amount. You don't want that sweat dripping in there.
Doctor, what's wrong? Don't you know where to make the incision?
All right, Nick, don't panic.
Oh, geez.
Think back to med school.
So med school is like college, right? There are people who party hard, but if you can party hard and still get everything done, perfect. But hopefully you're not in the middle of an operation and having to think back of how to actually do a procedure.
Seriously, baby, I can prescribe anything I want.
Oh, jeez.
I know I'm supposed to cut
my
something, but what?
Okay.
And where?
You don't want that kind of doctor not even knowing where he's supposed to cut or what he's supposed to cut. And then, to make everything worse, he pulls down his non-sterile face mask with his sterile glove. Now his right hand is not sterile anymore. He needs to re-sterilize that side. That's crazy. I don't want that doctor operating on me, any of my friends or family. Crazy. Let's check out clip number 4.
Hi, everybody!
Uh-oh, it's the same surgeon.
Now, there are many options available for
Dr. Nick.
underweight individuals like yourself. I recommend a slow, steady gorging process combined with acyl horizontology.
Of course.
You'll want to focus on the neglected food groups, such as the whipped group, the congealed group, and the chocotastic.
What can I do to speed the whole thing up, Doctor?
Be creative. Instead of making sandwiches with bread, use Pop-Tarts. Instead of chewing gum, chew bacon.
So Homer obviously is not underweight. He is way overweight. Probably has a BMI greater than 35, body mass index. But now he's got a food pyramid that's all sweets and candies and grease. Not so good. Do not make a sandwich with Pop-Tarts. I mean, it maybe sounds tasty, but I wouldn't do that. You really need to watch what we eat and keep our bodies as healthy as possible. And even now, the food pyramid is changing because we're discovering and finding out that there's a certain amount of foods that we need and not need actually in our diet.
You could brush your teeth with milkshakes.
Bart, great idea. Let's brush our teeth with milkshakes. I mean, if I could have a chocolate peanut butter milkshake every day, I'd be one happy dude. But I also want to live as long as possible, and that's definitely not one way to get there.
Hey, did you go to Hollywood Upstairs Medical College too? And remember, if you're not sure about something, rub it against a piece of paper. If the paper turns clear, it's your window.
Oh my gosh, that's horrible. Rubbing food on paper to get all the grease to show that it's that horrible for you, that's pretty funny, but that's horrible, okay? Don't do that. Fried chicken, bad idea. It's made with different oils that you shouldn't even be ingesting to begin with. Let's check out clip number 5.
Homer, I'm afraid you've torn out your anterior cruciate ligament.
Did you say anterior?
Yes?
Oh no! Anterior cruciate ligament, okay? ACL, everybody knows about this, right? There, you have one in each knee, and it basically connects the top part of your leg to the bottom part of your leg, the femur to your tibia. So if you tear it, sometimes you can have it surgically repaired by putting it back, or you actually might need a cadaveric or another animal's. There's all different ways that you can actually get a new ACL, but you really need it to have a good functioning active knee to be able to do all different movements.
Now, how did this happen?
Maybe a little morphine would refresh my memory.
All right, morphine, yes. It feels good to some people because it doesn't actually affect the pain in a limb or an arm or skin. It actually affects the receptors in your brain to tell you not to care about the pain. So you have to be careful because morphine, as well as any other opiate, reduces your respiratory drive. And unfortunately, that's how people die. It reduces their respiratory drive so much that they literally just stop breathing on their own. So be careful.
I don't know. I'm still a little hazy.
Oh my gosh.
Oh,
This is horrible that this is on a cartoon.
like it was yesterday.
Oh my gosh.
It happened today.
Hey, man, you're harshing my buzz.
See, he's talking about being buzzed.
It all started when...
Oh my gosh. Playing basketball, nice.
You go, Homer.
Oh my gosh. All right, I love The Simpsons. This is hilarious. Obviously, he's not going to dunk on a planet. Very funny, and yes, morphine, Dilaudid, fentanyl, any of these IV drugs will take you to another planet. Basically, that's what The Simpsons are trying to tell you. All right, those clips were a little far-fetched, but for a comedic animated show, it was super funny and amusing to comment on. Great job to the creator and the rest of the team who created the show. Super entertaining to watch. Although not entirely medically accurate, and Dr. Nick and Dr. Hibbert may need their medical license revoked, possibly. Just saying. Do you have a favorite show that features medical situations that you want me to react to? Let me know which show or episode in the comments below. And if you want to see me react to video games, check me out on Experts React series on Gameology. I'll link to them below. And as always, make sure you subscribe and turn your bell notifications on if you want to see more videos like this one. Thank you so much for watching and stay healthy, my friends.